There are signs that COVID is making a comeback, and some health officials are concerned about a possible fall surge, with two variants starting to take hold in parts of the world. Dr. Lisa Barrett is an infectious disease expert, well known to viewers of this program for sure. Doctor, COVID-19 infections and reinfections are increasing in some parts of the Northern Hemisphere, according to the WHO. How concerning is this?
Well, it's definitely not unexpected. The timing of when we were going to see more cases was always up for debate. And I think what we're seeing now is probably the first part of what we're going to see for the fall. So, is it concerning? It's definitely something to take note of, particularly if you're going to be out and about in the next few weeks. I think anecdotally, we all hear that friends of ours are sick at the moment. There's lots of folks around starting to get colds again, and good to think about COVID.
And of course, it's never that far from our minds. I'm sure those people who have colds are many of them testing for COVID. But now we also hear about the rise of a couple of variants as well. Are they here?
Good question. Eventually, they will be here. So I always tell people, they're like, are they here yet? Doesn't really matter. The big thing for me is that this is definitely, feels like the start of the fall upswing. The two variants that you mentioned are both still Omicron family. One of them, super transmittable, does seem to be still a good match for your old immunity that you would have gotten. The next version, a little bit less like the previous versions. And so there is some concern that that one might be less covered by the antibodies you had from past infections. So good to know it's coming. They will get here almost certainly. And the one that's the most different, we're not sure yet how quickly it's going to spread around the world. Still waiting to see.
And some people wondering, they might have had the most recent booster shot, whenever that was for them, wondering whether they might still have any immunity or protection as a result of that. What would you tell them?
I would tell them that any vaccine you've gotten is definitely going to be of help, particularly from getting very sick, especially if you're somebody who's older or has a poor immune system. So, those booster shots, even if this virus is slightly different, is not useless. It is still useful. It is most useful closer to your last dose of vaccine or natural infection. So if you had an infection in the last couple of months, you will still have some protection just through your own immune system. So vaccine's not useless, even if these are new strains. And certainly if you haven't had all of the primary ones you were supposed to get, you can still get your update in Nova Scotia.
We are seeing some health facilities in the wider region being closed to the public because of what they're describing as outbreaks. When you look at that kind of a situation, does that suggest that this might be the beginning of a new wave, or at least that sort of typical fall period that you might expect with viruses?
Yeah, I was pretty sure we weren't going to get into the late fall. Influenza generally comes in the later fall, like November. To be honest, I'm not sure if people recognize this, but COVID never really went away, and we were still hearing about hundreds of cases a week, not necessarily in hospital, but hundreds of cases that either people self-reported or through their lab here in Nova Scotia. So never went away. And I think that you're right. This is probably the beginnings of the upswing, but we really do have to see what happens over the next few weeks. To me, it's like you got friends and family all around you that are getting respiratory viruses. Now would be a time to just be a little more careful. And there are lots of tests in the community for COVID, at least. Make use of them.
It seems, we went through a period where the tracking of the virus was so, almost precise, really. Is the virus going to be more difficult to track now, given that there seems to be less reporting of individual cases?
Well, certainly we won't be going down to knowing how many actual cases there are. We always underestimate it, even at that intense time that you mentioned. But like every other province, public health in this province has a very defined, very specific scientific plan to monitor the virus called a surveillance plan, a surveillance approach to looking out for the virus. So that'll tell us when things are relatively going up. And in particular, it gives more information on high risk situations like hospitals, like long term care in particular. So if you are younger and you're just in the community, you may want to do your own unofficial surveillance and just make sure you are keeping an eye on who's sick around you. And if you're sick yourself, it's okay to want to test and know if you've got COVID or something else.
Dr. Barrett, always good to talk to you. Thanks very much for this today.
Okay, thanks. Talk soon.